Hello, everyone. We're recording this part of the webinar on June 13th, but we're going to be going over the community input collection that was completed as part of the 2018 to 2019 CHNA Community Health Needs Assessment. So we collected community input through 4 methods in partnership with Alliance Partners. We distributed a community input survey between fall and early winter 2018 to 2019. We also conducted focus groups through the Alliance for Health Equity and in partnership with Westside United. There were focus groups completed with healthcare and social service providers, as well as 2 stakeholder assessments that were led by Chicago Department of Public Health and Cook County Department of Public Health, looking at the forces of change that can impact health and communities, as well as understanding capacity to address health equity within the public health system. So the purpose of collecting community input, we had 3 overarching purposes: to understand the current health status of communities. So we asked questions such as, what communities think are the best things about where they live, work, and play? What is making communities healthy or unhealthy? And what are the top health needs or issues in the different communities across the county? We also asked about barriers or facilitators to a healthy community, such as how easy or hard is it for you to access healthcare or mental health treatment or substance use disorder treatment when you need it? What types of programs or services are available in your community for children, for older adults, for other family members? How do we improve health equity? Like, what are some social and economic strategies that can be used to address the inequities that community residents are seeing every day, as well as strategies for addressing health needs? So we want to understand, what are community priorities around what needs to be improved most, and how can hospitals, health departments, and community-based organizations work together to address those needs? We also want to know how communities, what role communities see themselves playing in the solutions and strategies that they suggest. So Alliance for Health Equity Partners focused on gathering input from communities that are underrepresented in assessment processes, as well as those who typically face a disproportionate burden of health inequities. So it's important to remember that this wasn't random sampling. We very specifically reached out to certain communities to hear about the biggest health equity issues that they're facing. So some of the examples of the populations that we're focused on for both the survey and focus group were immigrants, LGBTQ+, veterans, justice involved, low-income families with children, homeless youth and adults, older adults, and ages in the focus groups range from 14 years old or older. The survey was distributed to adults 18 years or older, and we got participation and responses from a diverse group of racial, ethnic, religious, and socioeconomic backgrounds.
So to start a little bit about the community input survey, like Leah mentioned, the survey was collected from August 2018 to February 2019, and during that time we collected 5,934 surveys. On the right-hand side, you can see the geographic distribution of survey respondents. Respondents were asked the question, what is your zip code? And that is how we've mapped this. You can see that we received responses from all over the county, with a slight skew in the west side of Chicago. We're very thankful for our partners for helping us collect these surveys. Some of our key data collection strategies included partnering with organizations in key communities. So hospitals and community-based organizations work together to collect these surveys. Some great examples of that would be our champion students, which are high school students that are convened through a UI Health program, and they went out into the communities that they lived in to collect over 1,000 surveys. Additionally, to uplift the immigrant community, we had help from the Polish American Association and Chinese American Service League to distribute our surveys that were translated into Polish and Chinese. Additionally, we had meetings to discuss survey collection with partners to find the best approaches to getting responses from our different respondents. One of our priority populations, as I mentioned, was immigrant communities. And so we would have meetings to discuss where is the best place to meet the respondents where they are, how do we show this as a benefit to their community and explain the importance of community health needs assessments and having their voice uplifted. And then lastly, translating the survey so that it's appealing to all different groups. So we translate it into Spanish, Chinese, Polish, and Ukrainian. And then on the bottom left, you can see our priority populations, which Leah also mentioned earlier. As just a review of some of the demographics that we have here, from the survey, we collected almost 600 surveys in Spanish, about 150 surveys in Chinese, and then about 100 surveys in Polish. One thing that we noted was that the Polish community, while some took the Polish translation of the survey, some respondents felt more comfortable selecting Polish as an ethnicity and taking the survey in English. Additionally, we asked demographic questions about if they had someone living in the household with a disability, and have had about 1,500 responses from that community. And then additionally, we asked about sexual orientation and gender identity. So we had about 400 responses from the LGBTQ+ community. And then finally, we asked about annual household income, and had about 1,700 responses from individuals with households in households with incomes less than $20,000 a year. Some of the key factors for a healthy community that came out from the survey were access to healthcare and mental health services, safety and low crime, access to community services, access to healthy food, and affordable housing, which aligns with a lot of the overarching topics that we found in focus groups. We also asked about the most important health problems in their community, and diabetes, mental health, age-related illness, substance use, and heart disease and stroke came out as most important health problems. And as we looked at the service areas for hospitals in smaller regional areas, we found that these health problems emerged as the top 5 even in the smaller communities, with sometimes other chronic diseases such as cancers and obesity coming up in their top 5 in the smaller regions. Additionally, we had 2 open-ended questions. One open-ended question was, what would you like to see improved in your community? These were written in responses, which were then coded and to overarching themes. And so that is where we got the themes of safety and low crime, economic development, infrastructure, community cohesion, and healthcare. The second open-ended question was, what are the greatest strengths in the community where you live? And the codes and overarching themes were community cohesion, community services, safety and low crime, transportation, and education. And as you can see, that there was a little overlap from what respondents would like to see improved and what respondents would consider greatest strengths in their community. And we did some brief mapping to see how this looked, and found that in some communities, respondents would say the greatest strengths would be safety and low crime, and then another respondent in the same zip code would say something they would like to see improved is safety and low crime. So that was something interesting that came out through this survey, the different experiences of respondents. So to get a deeper understanding of our priority populations, we did cross-tabulations of responses from those who identified as different priority populations and their responses to the multi-select questions. What do you think are the 3 most important health problems in your community? And what do you think are the 3 most important things necessary for a healthy community? And as you can see, for the LGBTQ+ respondents that we pulled out, that mental health, substance use, and violence appear more often in the LGBTQ+ community of respondents. Additionally, for the question, what do you think are the 3 most important things necessary for a healthy community? You can see that for LGBTQ+ respondents, the access to healthcare and mental health services really appeared more often, and same with safety and low crime. Whereas for the overall respondents, access to community services seemed a little bit more of a priority. And we did the similar crosstabs for older adults and younger adults to kind of see where their priorities lie and how we can address these needs on a more community level for them. And as expected, older adults prioritize things like age-related illness and chronic diseases such as cancer, diabetes, heart disease and stroke more frequently than younger respondents. And then on the opposite end, younger respondents prioritize mental health, STIs, STDs, substance use, and violence more often than older adults. And then for the things necessary for a healthy community, there wasn't as much variation in the responses, but you can still pull out that for younger adult respondents, access to healthcare and mental health services was more important. Additionally, safety and low crime, which echoes the health problems question. And then interestingly, clean environment really came out as a priority for young adult respondents. For older adult respondents, access to community services and transportation were clearly more important, and does align with the chronic disease and age-related illness health problem responses.
Great. So for focus groups, we completed 57 total in partnership again with Westside United, which is a regional group of hospitals working together on issues specific to communities on the West Side. The 31 focus groups were conducted by Alliance for Health Equity staff, and 21 learning map sessions were conducted by Westside United. And Alliance for Health Equity worked with Westside United to make sure that the questions and info that we collected overlapped between these 2 types of sessions, so that we both had useful information that could be gathered from the 2 different types of community input collected. We also conducted 5 focus groups with service providers and community leaders. And how we reached out to these organizations is primarily through our hospital, health department, and community-based partners. We asked them for recommendations on the communities we should focus on, and they really helped to drive the connections and our ability to arrange to conduct focus groups in these different communities. What you see on your screen is a list of the focus group host organizations where the focus groups took place and the Westside Unite Learning Map sessions took place. So what communities told us is that there were 4 overarching themes, and then we had 3 cross-cutting themes that really permeated all of the discussions. So racism and discrimination, safety and violence were topics that came up, whether we were talking about behavioral health, access to healthcare, chronic disease, healthy lifestyles. Those issues permeated, again, all of those discussions. Community cohesion was another cross-cutting theme. So community cohesion, meaning the connection that people feel with their neighborhoods, with their communities, and understanding that these communities have a lot of knowledge, they have power, they understand the solutions that are needed to address their health needs, and that it's really important that their voices and that their expertise be used when implementing strategies to improve community health. The other 4 major themes that were discussed, behavioral health was the top topic discussed by focus group participants. Access to healthcare and community resources was the second most discussed topic. Social and structural determinants of health, as well as how those social and structural determinants influence other issues like chronic disease or mental health, was another top key theme. And chronic disease also was a prevalent theme across the focus groups in the city and county. So for mental health and substance use disorders, there are a few key takeaways. So trauma and chronic stress are extremely prevalent in the communities that we talk to. And this trauma and chronic stress are underlying root causes of poor health outcomes and also social determinants of health, such as violence and poverty. Homelessness, mental illness, stress, and trauma are both root causes and direct outcomes of substance use disorders. A lack of mental health awareness and education leads to stigma, worsening of mental illness and substance use disorder, poor overall health, and lost lives. And when we spoke to providers and community residents, they all agreed that access to mental health and substance use disorder treatment and services is critical for a community to be healthy, but almost universally access to these types of services is lacking in those communities in Cook County. So some of the examples of responses we got from participants include like the importance of having services to support folks who are going through trauma and chronic stress. That there's a lot of stigma and that's impacting individuals' ability to access the care they need. That patients are traveling far distances and really struggling to find providers that take public benefits, that take private insurance. There really is a lack of not only provider availability, but like geographic and logistical access to services. And that when these services are lacking, we again start to see other issues like substance use disorders, violence, continuing generational trauma that continue to perpetuate and pop up in the communities we spoke to. Again, access to care was the second most discussed topic. The key takeaways are that policy changes are making it more difficult for communities to access private and public benefits. An example that came up repeatedly when we spoke to immigrant focus groups is the draft public charge, and how that has made several communities scared to access public benefits with the fear that it might affect their ability to get citizenship status. Another issue that came up is like changes to how medical cards are distributed and how long that takes is really impacting how quickly people can get care when they need it, with wait times sometimes going as long as 6 months to a year to get medical card for basic needs like vaccinations for babies. There are profound differences between communities in the quality of healthcare available and received. This is particularly highlighted by individuals with disabilities, individuals living with mental illness, and communities of color. It was loud and clear from what participants said that they feel that often they are not receiving the same quality or level of care that other groups of people are receiving. Many families are struggling with inadequate insurance coverage and limited provider availability, and this is particularly true for those receiving public benefits and veterans benefits. And again, this links back to mental health care. These issues are cross-cutting between access to health care and mental health services. And then many communities lack affordable community-based services. And another group that we spoke to in particular, so that lacking insurance coverage and access to health care can really cause stress and trauma for people who are not well and need help. So some examples, again, the quotes here talk about how like the administration and government policies, even if they aren't implemented yet, are affecting how immigrants are accessing care, how our bureaucratic system for accessing public benefits is causing delays in care and difficulty for people receiving appropriate care. And not having health insurance definitely, again, just like public benefits, impacts when people seek care and how serious their conditions get before they actually receive the help they need. For social and structural determinants of health, a lot of the discussions around social and economic factors is how inequities in economic investment and development, employment opportunities, transportation resources, quality affordable housing, education opportunities, and healthy food access are really driving the health issues and health outcomes we see in communities such as chronic disease. So there are many factors, again, that focus group participants mentioned. Some of the key takeaways include that, like, the lack of new business investment and development in certain communities is due to factors such as long-term divestment by both private businesses and local governments, and that the loss of locally owned businesses, limited educational resources, low levels of home ownership, and minimal employment opportunities are making these problems worse. Communities of color are struggling with high rates of unemployment, and in communities of color where jobs are available, focus group participants describe them as part-time, temporary, or low-paying. Individuals living with mental illness, young adults, homeless individuals, and formerly incarcerated face significant additional barriers to employment, regardless of where they live in the city and county. Major education concerns that focus group participants mentioned included school closures, poor quality schools, limited resources for learning trades, a lack of support programs such as low-cost tutoring, and limited adult education programs. Youth of color face large inequities in employment and skill building opportunities. Housing instability, homelessness, rising housing costs, and poor housing conditions are all contributing to poor health outcomes in certain regions of the city and county. And these issues were particularly prevalent in the south and west sides of Chicago and the south and west suburbs. And there are significant geographic and financial barriers to accessing healthy foods in certain communities, again, primarily focused in the west and south sides of the city and suburbs. So for chronic disease, a lot of the focus group discussions really did, again, focus on how social determinants such as poverty, limited access to healthy foods, exposure to violence, and housing conditions are both underlying root causes and barriers to the management of chronic disease. For many communities, they described how education about preventing chronic disease, what the risk factors are, and when they should seek medical help is lacking in communities, and that there needs to be more dialogue between community members about the health conditions that are affecting them. Chronic illnesses such as asthma and diabetes can be isolating for youth, parents, and adults, especially when they feel they don't have adequate community or family support for managing those chronic illnesses. And a big solution that was mentioned is that additional community groups that share information about resources and support each other with adjusting to healthier lifestyles would be extremely helpful to communities. So again, if you look at some of the quotes, you can really see where focus group participants highlight disparities. In the south suburbs, we had young people who said, there's one gym, otherwise you have to go to another community to exercise. Youth on the south side of Chicago pointed out that they have a really high concentration of fast food restaurants, very limited access to affordable places to buy food or places to just buy healthy food, period, like Whole Foods or Mariano's. Again, another participant on the south side highlighted the need to have discussions within communities about the health issues that are impacting them. And again, on the south side, they mentioned how adults that were dealing with diabetes mentioned how social media, community groups, workout buddies really helped improve their ability to manage their condition. So those were the main key takeaways, again, for these 4 major themes and 3 cross-cutting themes. Behavioral health and access to healthcare being the top 2, social determinants of health being another important critical component discussed, as well as chronic disease. So although this webinar was recorded on June 13th, the folks who are live in the webinar right now would be happy to take any questions you have.
And before we actually wrap up, I wanted to kick it off with one question for you, Leah. So you mentioned that one of the things that was discussed through the community input was the role that communities see themselves playing in solutions, and you pointed to that in terms of the cross-cutting theme of community cohesion and how that ties into community power and solutions that many communities already know are working and can be connected back to some of the healthcare and public health institutions. So could you just speak a little bit more to what you heard from the focus group participants around community cohesion and how that relates to the collaborative solutions we can work on together?
Yeah, so I think one important thing to note is that communities who did have programs or services available said there's a lot of duplication of efforts, and that a lot of the efforts that are currently in place are not addressing some of the sort of like underlying issues. For example, a workforce development program was mentioned, but then they get to the end of the workforce development program and nobody has IDs from the state, and that makes it difficult for them to fill out any job applications. And so they said, you know, if they had spoken to community residents, that might have been an issue that could have been implemented into that or integrated into that program ahead of time. So refining programs that are already in place is one role that, or refining programs that are being developed is one role that communities see for themselves. Another, again, is like, where are resources going? So maybe we don't need 5 workforce development programs in our community. Maybe there are other issues that need to be addressed first, like housing or food security. So really making sure that the decisions we make about programs that we support or try to implement that are new, at least, we need to be taking a community-driven approach where we really take the lead from communities on what needs to be implemented. And also there are a lot of really great grassroots efforts that are being led by communities. For example, there are a lot of grassroots efforts around like community gardens or mentorship or tutoring programs, and that a lot of these programs just need additional support to keep running, to expand their programs because they're a successful evaluation, grant-making tools. So finding ways that we can connect with these community partners that are already on the front lines, and how can we support those programs that are already in place is another role that communities see for themselves, and also having a place at the table. So being a part of like our decision-making processes overall was very important to the community residents we spoke to.
Great, thanks.